Hello everyone, it's Dr. Eloise Matthews from Pinnacle Sports Physicians, and I'd like to talk to you about osteochondritis dissecans today. Osteochondritis dissecans affects mostly our adolescent population and is more common in males than in females. It's quite an obscure process where a combination of factors come together to cause a partial or full separation of the articular cartilage from the subchondral bone. So those factors are a combination of a genetic predisposition, multiple episodes of micro instability or micro trauma to the joint. Patients will often present with pain. They may have an effusion of that joint and focal tenderness over the area that is affected. Where does this occur then? So we can see this in multiple areas around the body, but the most likely area you'll see it is in the knee. And inside the knee, the most common area is the lateral aspect of the medial femoral condyle. That's about 65% of all knee OCD lesions. The other places we can see it is the lateral femoral condyles, that's about 20%. And the important thing to remember about them is that in that area, the lesions are often larger and the prognosis is often worse. So they are important to pick up. You can also see it in places like the patella and the tibial tuberosity less commonly. The next most common site is the elbow, and in the elbow it's the capitellum that's most likely affected. We see that in two main groups of sporting teenagers. The first is gymnastics, because they are spending a lot of time weight bearing on their hands. And the second is in throwers due to the repetitive valgus strain that's put on the elbow during the throwing motion. The next most common joint is the ankle, and it's over the medial talar dome that we most commonly see OCD lesions. We stage these into 4 stages. Stages 1 and 2 are stable, and stages 3 and 4 are unstable. If this is found incidentally on imaging, and that they don't actually have symptoms from their OCD lesion, then we're happy to follow these up and repeat imaging in about 6 months and just keep a good watchful eye on these patients. If, however, they have symptoms but have open growth plates, then we need to restrict activity. And by restrict activity, I mean we need to avoid impact loading of that joint. So we'll restrict running, we'll restrict jumping, we'll restrict hopping type activities. They can continue with stationary cycling and running in the water as long as they don't have pain. So what's really important once we've staged these lesions is the management of them. And that largely depends on whether the growth plates are open or closed. Regardless of the stage, if there's closed growth plates, the prognosis is poor, and at some stage they will progress to being an unstable lesion with a loose body inside the joint. So all of those OCD lesions need to be seen by a surgeon. If they have open growth plates, the prognosis is better, and the younger we pick this up, the better the prognosis is. That's a nice wee summary of OCD for you today, and I hope you tune in to our further educational videos that we'll continue to produce. Have a good day, guys. See you.